Disorders, its directors and employees, assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented on our site. We do not endorse any recommendation or opinion made by any member or physician, nor do we advocate for any treatment. You are responsible for your own medical decisions. Now I'm going to turn over the introductions of our speaker to Martha Butterfield, the Program Coordinator of NJCTS. Marty?
Thanks, Kelly, and welcome to tonight's webinar. I'm pleased to introduce our presenter for the evening, Dr. Daniela Colognori. She received her undergraduate degree from Boston College and her doctorate in clinical psychology from the Graduate School of Applied and Professional Psychology at Rutgers University. While in the graduate program at Rutgers, she was selected to be a clinician in the New Jersey Center for Tourette Syndrome practicum, where she treated kids and families living with TS. Currently, Dr. Colognori is a postdoctoral clinical research fellow at New York University Child Study Center in New York City. She specializes in the treatment of anxiety, OCD, and tic-related disorders in children and adolescents, as well as the dissemination of evidence-based treatment to community settings such as schools and pediatric clinics. We're delighted to have you join us tonight, and I'll now turn the presentation over to our guest speaker.
Thanks, Marty, so much for the introduction. As you mentioned, I'm a proud graduate of the TS program at Rutgers, where I was lucky to work with many wonderful kids and families. And currently I'm working at the NYU Medical Center, and I work on a research project involving teenagers with social anxiety under the mentorship of Dr. Carrie Warner. So let me just go over my goals for today's presentation. The first is to describe social anxiety disorder and give you a feel for what it looks like and how to identify it in kids and teens. And to really kind of drive home the point that social anxiety disorder is something that often goes undetected and untreated, even more so than other types of anxiety disorders. And one of the reasons for this is because people often equate social anxiety to just being shy or just part of someone's personality, and also because many of us can relate to being anxious in social situations. Like, for example, giving this webinar. Everyone feels nervous sometimes in certain social situations. But what I really want to do tonight is to highlight how it can become much more than just shyness, and how it can really become impairing to kids and teens and adults. And then lastly, to introduce some treatment strategies and some tips for parents or teachers or other school professionals in terms of how to prevent and help children and teens cope with social anxiety. So let's start out by talking about what social anxiety disorder is. It's also referred to as social phobia, so I might use those terms interchangeably. But as described by the Diagnostic and Statistical Manual of Mental Disorders, also called the DSM, which is our psychology reference book, social anxiety disorder is a marked and persistent fear of one or more social or performance situations in which the person is exposed to unfamiliar people or to possible scrutiny by others, and the individual fears that he or she will act in a way or show anxiety which would be humiliating or embarrassing. In children, there must be evidence of the capacity for age-appropriate social relationships with familiar people, and anxiety must occur in peer settings, and it can't just be confined to adults. It's important to understand that the capacity for age-appropriate social relationships is important in terms of diagnosing people with social anxiety disorders because it differentiates them from children or teens on the autistic spectrum, whereas in social anxiety disorder, they're able to form these relationships. They have the skills to form the relationships, but they're inhibited by their anxiety, versus someone on the autistic spectrum disorder who we have trouble and have deficits in the skills and don't have the capacity necessarily for age-appropriate social relationships. Next, exposure to fear situations almost always consistently provokes anxiety, which may take the form of certain panic-like symptoms, and in children might also be expressed in behaviors like crying, tantrums, freezing, or shrinking away. And one of the most common things that we see, and one of the hallmark behaviors is that the feared social or performance situations are avoided or endured with intense distress. Also, most adults are able to recognize that the fear is excessive or unreasonable, although this is not a requirement for children and some may not. And that also the avoidance, the anxious anticipation, or distress while in fear situations interferes significantly with the person's normal routine, occupational or academic functioning, or social activities or relationships. And we're going to talk a lot more about this in a little bit. And it has to last for at least 6 months, so it can't just be a passing phase. So to give a richer description of what social anxiety disorder looks like, this is data from a study of children who were aged 7 to 13 who had been diagnosed with social anxiety disorder. The left column lists commonly feared social situations, and the right column provides the percentage of children in the study that endorsed or said that they felt at least moderate distress in that situation. So let's take a look. It's important to think about how even within each situation, there can be variables that can make it more or less anxiety-provoking to each individual. So for example, reading out loud in front of the class. This may vary from kid to kid in terms of they may have some classes that they can participate in, and this does not make them feel that anxious. So it might be that there are less kids in that class, or they have more friends in that class, or they feel more comfortable with the subject matter, or feel more comfortable with the teacher. So all of these different variables might make it so that some classes are more difficult than others, and that's a normal thing for us to see. It won't necessarily be across the board. A few others are musical or athletic performances, joining in on conversations, speaking to adults, starting conversations, doing things in front of the class that don't involve speaking, like writing on the chalkboard, ordering food, attending dances or parties, answering questions in class, working or playing with other kids, asking teachers for help. A lot of times it makes a difference. Kids will tell us whether they are asking the teacher privately or having to raise their hand or doing it in front of other kids. Gym class, there's a lot that can go into gym class, like having to do athletics in front of other people, how other people are judging, how well they're doing in athletics, getting picked for teams, and for some older kids or teens, having to change in front of other people in the locker room can be very anxiety-provoking. Going to meetings, having their picture taken. This one, not all kids, even if they're anxious about it, won't avoid it, but then it may come out as them being extremely critical about how they look in the picture and their appearance. Using school and public bathrooms is the next one. And it's important to understand that this is not for a fear of germs or contamination, more typical classic OCD fears, but more of they're worried about people seeing them or hearing them in the stall or having to interact with people in a closed environment. Inviting friends to get together is a pretty common one. Eating in the cafeteria, which involves things like having to ask people to sit with them or knowing who to sit with or having to go to the lunch line and order food from an adult. Those are all situations within the cafeteria that can be anxiety-provoking. And the last couple, walking in the hallways. And sometimes, that's not a situation where kids can avoid it, but sometimes they'll avoid it by maybe looking down or walking quickly, not making eye contact, answering or talking on the phone, and this could be with a variety of people. Again, they might not feel nervous talking with friends or relatives, but they might feel nervous talking to extended relatives that they don't see often, or having a call to place a food order, things like that. And eating in front of other people, a lot of times we'll hear kids say that they're nervous that they're going to get stuff on their face, or people will think that they're eating too much, or that they might spill something. These are the types of things that go into fears in the situation of eating in front of others. And just to follow up on that and give you an idea of some other types of situations that we hear more that are more applicable to adolescents and adults. Presentations and public speaking is probably by far the most common one in adolescents that we hear and in adults. Job interviews, understandably stressful, but for some people, you know, it can become overwhelming, and they may start to avoid or try to avoid those types of situations. Dating, making social plans, and what I mean by that is actually kind of being the one to organize a group or to come up with an idea of something to do together. And one of the reasons that we find that to be stressful is because we find that individuals with social anxiety disorder often tend to feel a very big responsibility that everyone is going to have fun. They sort of take too much ownership of what they're doing and what the plans are, and really put a lot of pressure on themselves to make it feel fun. Speaking to store clerks, making special requests when ordering, so anything outside of just making the order, but having to ask for, you know, dressing on the side or extra cheese or whatever it may be. And just generally being assertive. So things like asking for favors, refusing requests or favors, so saying no, standing up for themselves, and voicing opinions. So in addition to feeling anxiety in the types of social situations I just described, research has also shown that individuals with social anxiety disorder tend to have some actual deficits in social skills. So their impairment in social functioning, it may result in a lack of effective social skills from performance inhibition due to anxiety, or from both. And studies show that performance in social situations by socially anxious youth is consistently rated as less competent than non-anxious peers, as judged by blind observers. So people who are watching them, don't know anything about them, are judging them, rating them as having less competent social skills as non-anxious peers. And individuals with social disorder also seem to be aware of these deficits, and in addition show some differences in their thoughts and cognitions. So across the board, developmentally, children, adolescents, and adults with social anxiety disorder evaluate their performance as inferior to non-anxious peers, which I just told you is pretty realistic because other people are evaluating in that way too, but they are aware of it. In addition to that, in anticipation, they expect to perform poorly in upcoming social interactions, and after the fact, they also ruminate about their poor performance in the social interaction. We've also found that kids with social anxiety have, all individuals with social anxiety disorder have what we call a hostile attribution bias, which is that they're expecting that other people are judging them negatively. And clinically, we've also observed the reverse of that, which is that some socially anxious teens also have hostile attributions towards others, like they're jerks, or you know, I don't want to hang out with them anyway because they're losers. These types of things. What we have seen some developmental differences in is what happens during the interaction. And what we found is that while there's evidence, consistent evidence in adults that during the interaction they're engaging in what we call negative self-talk, which is thoughts about how poorly they're doing or what a bad job they're doing or how incompetent they are. So we've seen that in adults. It's less clear in adolescents. So there are some adolescents are reporting very small amounts in the studies that have been conducted on this. And taking that one step further, children aren't really exhibiting any evidence of this at all. So these sort of negative thoughts and cognitions during the social interaction seem to be developing throughout the lifespan. They're not present in kids and seem to become more and more present in adolescence and then into adulthood. So hopefully by now I've convinced you that social anxiety disorder is a clinical problem that is more significant than just shyness. But we also often hear, well, isn't it just a phase? Won't they grow out of it? And unfortunately, the answer is usually not. So the most common course of the disorder is a child who has a history of social inhibition or shyness as a young child and throughout elementary school, with the onset of it really becoming impairing in mid-teens. It's also possible for the onset to follow abruptly follow a stressful or humiliating experience, like bullying or some very humiliating experience or rumors. But no matter the onset, it's been shown that the course of social phobia is often continuous and stable, and it often lasts into adulthood. And if untreated, can also be has been shown to be associated with the onset of other disorders, particularly depression and substance use. So if social anxiety disorder is a stable condition that often lasts into adulthood, it's important to understand that it can really be impairing. Now, the obvious domain where it can become impairing is in friendships and activities. So in that same study that I showed you earlier that listed all of the commonly feared social situations in young children, they also found that 75% of those kids reported that they had no or few friends. 50% of those kids were not involved in any extracurricular activities at all, and 50% said that they did not like school. Another domain that can be impaired in kids or adolescents with social anxiety disorder is in academic and athletic performance. So kind of what I touched on before in going over some of the commonly feared situations, a lot of times kids have huge difficulties with things like giving presentations, approaching teachers, or asking and answering questions in class. This often can have negative effects on their grades for presentations, general participation grades, and also really interferes with their ability to form relationships with teachers, which is an important aspect of high school and college. Also, poor concentration can be problematic, and that's sort of true for all types of anxiety disorders, but there's a lot of social situations that happen in a school day, and so there's a lot more things to fear during the day, and so these thoughts can become sort of all-consuming and really get in the way of kids' ability to attend and listen and really be present in class and really be taking in the information that they should be. In really severe cases, social anxiety disorder can also lead to school refusal, so just absolutely not refusing to go to school, and it can sometimes even be like avoidance of one particular class. It might not be all of them, or one that may require more participation, but for some kids ends up being sort of across the board. They refuse to go to school altogether. Diminished performance, we sometimes see this in the realm of athletics, so fears about messing up or letting their teammates or coaches down. And also an impairment in being able to communicate, and not just with teammates, but also with coaches. So, for example, we had one girl in our program that was a gymnast and was having some pain and felt really uncomfortable talking to her coach and didn't want to let her coach down and didn't speak up about it and ended up, breaking her wrist. And really leading to a bigger injury, more so than it needed to be if she were, able to communicate effectively and able to stand up and say, I'm having too much pain. I don't think I should compete, or what do you think I should do? And obviously, also too can lead to impairment in the occupational functioning. So trouble getting a job. So doing things like inquiring about whether there are openings. Filling out applications, going to interviews, and following up on job applications can all be difficult things for people who have social anxiety disorder. And also, once someone is in a job, it can be, given some of the difficulties we talked about in terms of being assertive and being able to voice opinions, can be really difficult to get noticed and, to get promotions or raises and to really advance in a way that, we would want. So, social anxiety disorder, we've talked about, is a real clinical phenomenon. It's stable and continuous and can last into adulthood and can become impairing in many different areas. But how common is it? Well, it really ranges depending on how you're looking at it. Lifetime prevalence, which refers to anyone who has had the disorder at any point in their lives. estimates for lifetime prevalence range from 3 to 13%. And above that 13%, there are higher rates for specific social fears. So, for example, someone who is only phobic about public speaking, which is a specific kind and which is the most common social fear. If you're looking at a clinical setting, so people who are not just people in the community, but people who are taking themselves to clinic settings for treatment, 10 to 20% had social anxiety disorder, but that varies widely depending on what type of clinic you're looking at. That's an estimate. And there was a recent study of adolescents in the community, so kids aged 13 to 18, that estimated the prevalence of social anxiety disorder specifically at 9%. So for one of my take-home messages tonight, do people with social anxiety disorder often get treatment? And the big answer is no. And despite effective treatments, evidence suggests that only the minority of youth are receiving them. And for all the reasons I've mentioned so far, like people thinking of it as just shyness, or that it's not really getting in the way, or it's just a phase, or it's just part of their personality, this sort of all leads to trouble accessing treatment. But the most obvious reason, too, is that these are people who are anxious about meeting new people and talking to new people and sharing things about themselves, all things that make therapy extremely difficult for people with social anxiety disorder. And other barriers that are common to all disorders, like the stigma of getting mental health treatment and also the accessibility of specialized practitioners. And just to kind of support my point, another recent study of nationally representative adolescents in the community show that overall, so across any mental disorder, only 1/3 of adolescents got treatment, about 36.2%. Now, of course, we expect that that rate is lower for anxiety disorders, and that was the case. So of adolescents with anxiety disorders of any type, 17.8 received treatment. And when we're talking about social anxiety disorder, specifically, only 12% of those adolescents with social anxiety disorder received treatment. So what are the treatments out there? Cognitive behavioral therapy is a treatment that has been shown to be effective for many types of anxiety disorders. And the same is true for social anxiety disorder. So exposure is theorized to be the main component, which consists of facing feared situations in a gradual manner. So starting with a situation that is less anxiety-provoking and slowly working up to more difficult situations. And the idea behind exposure is that repeated practice decreases the difficulty of being able to get through that, and anxiety and avoidance will also decrease. It also leads to changes in cognition. So once, we all know, we've all sort of had situations that we've really feared, and once we're able to kind of get going or get started, also kind of can feel that it gets a little bit easier once you're in it, and that once you're finished with it, you're able to really look back and say, well, it wasn't really bad as I thought it was going to be. So that's sort of what exposure is based on. There's also a cognitive component to CBT. There's been some suggestion that specifically for social anxiety disorders, the cognitive piece is more critical, more important for adolescents than adults, because as we talked about before, children aren't having quite as much of negative cognitions during social interactions. But other people have kind of argued back that it's important then to give kids these skills as a preventative means so that they don't develop into adolescents and adults that have a lot of these negative cognitions. So what is that cognitive piece? Well, it consists of realistic thinking strategies. So kind of helping kids to question some of their really exaggerated negative thoughts. So by challenging them, by thinking things like, well, what's the worst that could happen? So for example, if we're talking about a kid who's really nervous about inviting someone else to hang out, you could say to them, well, what's the worst that could happen? And you might get something like, well, they could say no, and they don't want to go because they hate you and they think you're a loser. Okay? And these are really the kinds of thoughts that kids are sometimes having. So the next step is sort of, okay, you know, I suppose that could happen, but how likely is it that that might happen? Well, not very. and you want to be realistic. So you can say, well, they might say no, but there's probably a whole host of other reasons why they might say no, not because they hate you. And you can usually kind of get kids to agree that that's kind of a realistic assessment of the situation. And then kind of the third question that we really use to help challenge some of these thoughts is, even if that worst thing happened and they said they're not going to hang out with you because they hate you, could you survive? Would it ruin your life? Yeah, it would probably be embarrassing and hurt your feelings for a couple of days, but do you think it's really going to have a long-term effect on, how you do in life? And, a lot of times you can get kids to kind of help put this back into perspective. Now, so that's kind of CBT in a nutshell, and I could talk about it for a long time, but I want to talk specifically about how it can be tailored to social anxiety disorder. And one of the ways that it's been done in the literature is to add social skills modules. And this is because of that data that I presented earlier, which shows that kids with social, not just kids, sorry I keep referring to kids, but it's true across the board, kids, teens, and adults, do show some deficits in social skills. Now, it may just be because they're not practicing enough. That's been one theory. But that's why it's been sort of added as a supplement to basic kind of classic CBT for social anxiety disorder. And so some of the types of social skills that we focus in on in our program is, first one is initiating conversations. So the main point here is to help relieve pressure of kids that they have to sort of have this perfect opening line, or they have to be super interesting right off the bat, or people are not going to want to have a conversation with them. So kind of really helping them to understand that the most common way that people start conversations is by just sort of commenting on something going on around them. So well, it's really hot in here, or, in school, this teacher's really boring, or whatever. Or also kind of commenting on something that they have in common. So if they see someone outside of school, commenting on, hey, aren't you in my English class, and things like that. So really trying to just find something very simple that is going on around you or that you have in common with someone is really the best kind of cue, the best kind of way to start a conversation. We also talk to our kids about how to maintain conversations. So once you get it started, how do you keep it going? And we focus in on teaching kids, training kids, and we all need help with this, to use open-ended questions more than closed-ended questions to help keep conversations going. And what I mean by that is closed-ended questions are ones that are really mostly going to get you just a basic yes or no answer. So for example, if I said, do you like baseball? There's not a lot of ways to answer that, kind of yes, no, or a little, or somewhat. And so we help kids to practice turning that around into something that can get you more of a range of responses. So instead of do you like baseball, to say what sports do you like? And really kind of just helping them to turn some of those questions around to facilitate more of a response and to get the other person to be able to give information that will help lead to follow-up questions to help keep the conversation going. We talk a lot, too, about listening and remembering. So we talked earlier about how all of these negative cognitions that are going on inside their heads, anticipating social interactions in the future and ruminating about past social interactions, all of this stuff is constantly going on in their heads. And what we find is, what we really try to tell kids is that how would anyone be expected to have a conversation or to participate in a group conversation if they can't concentrate? So we really kind of practice help them to practice listening to what it is people are saying and then remembering that information so that you can use it in your follow-up questions to help maintain conversations and to keep them going. And lastly, we do some assertiveness training, so helping them to practice to say no to favors and to ask for favors, and when saying no, just to stay calm, and that honesty is usually the best policy because excuses can sometimes snowball into bigger problems, and really just kind of practicing this. And with all the social skills, all these modules that I've just gone over, touched on briefly, we teach through modeling, role play, and practice. which leads me to the next point, which is that, again, more so than other anxiety disorders, specifically social anxiety disorders, lends itself well to group treatments. Now, this sometimes logistically can be difficult and can be difficult to find such treatment, but it's really been shown to be very effective. And you can imagine that some of the reasons are, kind of going off of how I just described what the treatment looks like. It's really helpful to have other peers in the same, going through sort of the same type of treatment so that you can use them to help each other to practice the social skills and role plays, to do exposures, so doing things that require an audience or peers, like reading out loud or giving a presentation, those types of things. And sort of a less obvious function of having it in a group setting is to help challenge some of these negative cognitions and expectations. So sometimes it means a lot, and I'm sure most people can relate to this, it means a lot more coming from a peer than an adult. And so a lot of times, and peers also are much more realistic with each other than they are to themselves. So it really serves a useful function in that aspect. And just to give you a quick idea of what an exposure hierarchy might look like for this type of a kid in this type of treatment, just as I described, so some of the situations that you see on the left might be familiar from that earlier slide. But what we would do is go from the bottom up. So for this particular child, and everybody's hierarchy will look different. Even if you're doing it in a group, everybody's will look totally different. Some of the same situations, but probably in a different order. So for this particular person, the least anxiety-provoking situation that they've listed is on the bottom, answering a question when you're sure of the answer. So they rated that as a 1. So what this is just their own subjective rating of how distressing it is for them. And so you kind of would work together to set up a practice situation where they could do that and sort of then reflect later on how was it, how did it go, was it as bad as you thought, and sort of helping them to come up with a system to repeatedly practice that until it became really not anxiety-provoking at all. And then when you accomplish that, then you move up to the next step. So in this case, reading unfamiliar material out loud in front of one person and find a way to practice, to set up a practice situation for that and to continue it until the anxiety decreases, and so on and so forth. And as I mentioned before, it's important with each of these situations, there could be a lot of variables within the situation that make it more or less difficult for the child. And that is crucial when you're setting up a hierarchy because you need to know what all those variables are. So for example, the most anxiety-provoking one on here, the number 10, is joining a group of popular peers. And you can see sort of, if you go down a little bit, something that is more difficult, like giving an opinion, might be more difficult than joining in a group. But if you're doing it with friends, it's a lot easier than if you're doing it with peers that you think as popular. So you really just have to sort of understand what are all these variables and how do they arrange themselves for each particular kid, and really understand so that you're working from the least up to the most anxiety-provoking situation. And then lastly, I just want to spend a little bit of time talking about tips for parents, but also other caretakers, teachers, and other school professionals about how to prevent some of these things and how to intervene when you're noticing that this is already becoming a problem. So the first one is validation versus excessive reassurance. This one is sort of a fine line, but let me see if I can get my point across to you. Excessive reassurance is what anxious kids pull for. So, is it going to be okay? Am I going to do okay? Are people going to be nice? Am I going to get lost? These types of things. Constantly just shooting, rapid firing, shooting questions, looking for you to tell you that it's going to be okay. Now, of course, all of our reactions is to just give that reassurance and hope that it helps to allay the anxiety. But it doesn't. What we found is that excessive reassurance helps very briefly for a very short amount of time, but kind of sets up a bad cycle, because what that does is it means that the child then is becoming dependent on you to give that reassurance, to get that decrease in anxiety, So they're not learning how to sort of do it on their own. And in addition, it's very reinforcing, which makes them, sort of the more you do it, the more they're going to ask for it. And so it kind of sets up a bad cycle and isn't actually really very productive or helpful in terms of helping to keep the anxiety down for more than a couple of seconds. We all kind of can relate to this. When we're worried about something and someone says, oh, don't worry about that, it's really hard. That doesn't really help. It doesn't really do much to decrease the anxiety. So what we would like you to do instead is to sort of validate that you understand that it's a scary situation. So something, but that you think that even though it's scary, you know that they're going to find a way to get through it, and it's probably not going to be as bad as they thought, and kind of remind them of all of the sort of cognitive challenges that you did before that we talked about in terms of the realistic thinking strategies. So instead of saying, oh, you'll be fine, don't worry about it, it'll be okay, to say, oh, I know, that sounds really scary. And I'm scared sometimes when I go to parties where I don't know anyone either. But, I know that you'll find someone to talk to, and, just remember some of the things that we talked about to keep your thoughts more realistic. So it's more of sort of a productive problem-solving type of reaction than it's just giving the reassurance. So that's step one. Another one is modeling non-anxious behavior. So helping the child or individual understand that everybody feels nervous sometimes in situations, but we find some way to get through it, and helping them see that that's true for you too. So to give you an example, sometimes we'll tell parents, make sure that you walk them through the times when you feel nervous. So for example, I have to call the doctor's office. So you have your kid there and you're saying, geez, I really hate calling this doctor's office because they have a receptionist that's usually really nasty and always makes me feel like I'm bothering her. So I'd like to just not bother, but we really need to get to the doctor. So I'm going to tell myself that it has nothing to do with me, she's just in a bad mood, and I just don't have a choice because we need to get to the doctor. So I'm going to make this call, and I know once it's over, it's not going to be as bad as I thought. And then I really won't have to think about it anymore because it'll be over with. So sort of kind of walking the child through the fact that that happens to you and how you think it through and how you get yourself to enter that situation even though you're nervous about it. By far, the most important thing you can do is to not permit avoidance. And this, is not meant to be harsh, but it's important to sort of always keep in your mind that in the short term, yes, sometimes it might feel like the right thing to do to let them avoid a scary situation because it makes them feel better. It doesn't put them through a difficult situation. But you always have to remember that in the long term, avoidance will absolutely increase anxiety because the child never learns that they can cope with the situation or that the situation isn't dangerous or that their cognitions or expectations are negative and exaggerated and that they're stronger than they realize. So it's just really important to keep that in mind. So when I say take small steps, I mean look for things that, kind of a mini hierarchy or a mental hierarchy of your own, things that you know that they can do, but they're a little distressed about, and start there to find opportunities for continued practice. And then once you feel like they've made some progress in that area, to find some other area where, imagine in your head that list that I showed you in the beginning of all the different kinds of situations, and sort of thinking about what is it for them that's difficult, and kind of then take it one step up and try to practice some ways. So for example, we tell a lot of the parents of the teams that we work with, things like calling to order pizza, or going to the register at a store, or asking a store clerk to open the dressing room. These are things that what we find when we start with the families that the parents is always just automatically doing these things for the kid because they know the kid won't do it for themselves. And we really try to encourage them to, again, start small, pick one of the things. You don't want to pull the rug out from under them and just stop doing everything. But to just pick one or two areas that are a little bit lower on the totem pole that you're, explain that you'd like them to start practicing. You know that they can do it, and it's hard, but it's important for them to be able to do these things for themselves. So you're going to stop doing it for them and kind of problem solve together about what's a good setting and time and way to practice. And in terms of, and sort of wrapping that up is that once they are able to do those things, so if they are ever able to successfully do some of the things that they've been avoiding that you're working on, to definitely reward that behavior. And remember that what you're rewarding is not the result. So not whether, if they invited someone to hang out, not whether they ended up going and having a good time. I mean, that's the ultimate result. But what you're really rewarding is that phone call, that first step that they took that was more than what they were doing before, to put themselves out there and to do something even though they were nervous about it. That's the key, because we really want to encourage them understanding that the anxiety is not going to just go away, and everybody has the anxiety, but we have to find ways to do the thing in spite of the anxiety. And that's really the main point. So to wrap up, just a couple of things that I've found helpful for parents, and parents have told me have been helpful. The first is a book, Helping Your Anxious Child, and that's by Ron Rapay, who's done a lot of research in social anxiety disorder. And there is a really great section in there about how to do the things that I've described before in a lot more detail in terms of coaching them with realistic thinking and how to set up exposures and sort of do your own at-home exposures. It really kind of also gives you a more detailed rationale for exposures and to help you understand that whole process a little bit better. So it's an excellent resource. There are two versions. There's two editions. They both have the same core stuff, so either one would be great. For websites, so again, I'm at the New York University Child Studies Center, and the website about our kids has a lot of good information, just for informational purposes, about different disorders and about what are effective treatments for those disorders. So that can be a good resource. And similarly, the Association for Behavioral and Cognitive Therapies, that website is set up for parents and other professionals who are looking for information about all the different childhood disorders and what are effective treatments and what they should look like and what they should include. And in terms of clinics, as I mentioned, I'm at the Child Studies Center in Manhattan, but there are also satellite offices in Long Island and Hackensack. And at Rutgers, there's, of course, the TS program with Dr. Rockmore, which I have worked in previously, and I think they do great work there. And also the Youth Anxiety and Depression Clinic with Dr. Brian Chu. Again, really, they do great work and are really, really up to date on the most effective treatments for anxiety. So that's all I have to say for now. I'm going to turn it back over to Marty.
Thank you very much. Great presentation. And I have a number of questions right off the bat.
Okay.
A question about a specific slide, okay, having to do with the recommended treatment slide. Could you expand a little more on the realistic thinking piece of that?
Sure. So with realistic thinking, what we do, in the treatment setting is the first step of that is to help kids to just access what are the thoughts. A lot of times kids, and I keep saying kids, but it's true for adolescents and adults as well, have a hard time even being aware of what their thoughts are. So first step is to really work with them to sort of write some thoughts down and try to figure out what are the thoughts that they're having. Then once you have some of the thoughts accessed, helping to sort of, I guess you first have to kind of gauge how invested, how strongly are they clinging to those thoughts, or how much do they understand that they might be a little bit blown out of proportion or exaggerated. And once you do that, the way we do it is sort of just use examples and use some of those challenging questions that I mentioned earlier. So sort of testing them on, so what specifically are you worried might happen? That's key because a lot of times people just have this sort of vague, cloudy sense of bad if I do that, it's going to be bad. It's going to be really hard. And so really helping them to pin down what specifically might happen. Because once you can get them to do that, you can't do much to challenge it's going to be bad because it's not specific enough. So you need to get them to list specific things, like before, as I mentioned, they're going to say no to my invite, or they're going to laugh at me. Once you can get them pinpointed on what it is, you have a lot more sort of ammo to say, well, when was the last time you saw that happen to somebody else? Or what makes you think that that's going to happen to you? Has that happened to you before? So it's just kind of getting them to understand that it's not a given. It's not a foregone conclusion. And you don't want to go all the way to the other extreme either. You don't want to go to that would never happen, because that's not true. It could happen. And you want them to understand that you're being realistic, but you also want them to understand that they're being too negative. So you kind of got to get them working towards the center a little bit more. And we really kind of, literally just give them those lists of questions and help them to use them on their own examples of their own thoughts. And in the group setting, we help them do it to each other. And help kind of, like I said, kind of, throw them to each other and say, how realistic do you think that is? Do you think she's being overly negative? And that can really be helpful.
Yeah, I could see that working really well in a group setting with kids. Yeah. Is there any evidence that social anxiety is more prevalent in boys or girls, or does that enter into the equation at all?
That's a great question. I think that the sort of conventional thinking is that it's more common in girls. And I think that the rates do show that it's a little bit more common in girls. But we certainly get plenty of boys coming through our treatments. And so, I think it is more common, but I don't have the rates offhand.
Okay. This is an interesting comment from a listener. This presentation is an eye-opener. And she goes on to say that she feels like a terrible parent. She's the parent of a 14-year-old boy and has insisted that he attend family and other social functions, basically telling him to just get over it and, go. And typically it doesn't go well, and there are unfortunate repercussions around that. So the mom wants to know, is it too late to do anything about this, and what's the first thing to do?
Well, I want to back up 1 second and say that actually probably the best thing that you can do is not let the child avoid it. So you're already doing that. But what I would say is maybe to try to give, and I don't know necessarily what the bad repercussions are, but what I would say is to try to give like one very specific small assignment, like have one conversation with, and of course this will depend on where the child is at now with what they're doing already and what they're avoiding. But to kind of maybe just give one small assignment, like have one conversation with, a relative that you don't see that much. And once that's over, then, maybe you can, go watch a TV show in a different room or go play on the computer for a little bit to get a break. So kind of the same thing we were talking about, setting it up to find one small practice situation that you think isn't way too hard but is a little bit challenging, and then giving some sort of reward for that effort if they're able to at least try it.
As I understand this question, though, it sounds like the parents have pushed the child to go, and then it doesn't go well. There's a meltdown, there's an incident or whatever, and then he's the one getting in trouble for it. So they need to have a pretty good discussion then about the parameters now for the next time they go.
Sort of what are the expectations?
Not to just ignore it and tell them to get over it, basically.
Right. It's important, like I said, it's important that they are continuing to go and not letting them avoid, but maybe really talking about what is expected of the child in that situation, and starting off really, really small, and then, not expecting, a socially anxious child to be able to perform for a whole 3-hour party with tons of people. That can be really overwhelming, but to set it up in a way where they have a few, like, sort of small challenges that won't make, that or you hope aren't too demanding and won't result in a meltdown, and then sort of slowly increase the difficulty, for the next time and the time after that. And to sort of talk about it beforehand. So before going to the party, setting up what's this little mini assignment, or what is the expectation, and then maybe practicing it. So role playing, well, what's something that you can use to start a conversation, or is there something in particular that you might want to talk about, and help them practice a little bit so they're not going into it cold.
Okay. Okay, got it. I just want to jump in with something here. I want to make sure everybody who's out there listening knows that there is a place to ask questions. We've had a number of questions, kind of all from the same people, so I just want to make sure everybody knows that there is a place to click to ask questions and type in your question. I'm sorry, I didn't mean to interrupt the flow, but I just wanted to make sure everybody was clear with what they needed to do with their question. Can you talk a little bit about what educators can do to help build a child's confidence and self-esteem? Would it be the validation and reassurance? Would those be the appropriate steps, or is there something different?
That is always important. It's always important to validate. The best thing that teachers can do is, to be understanding and keep your eyes open that there are kids like this out there, and they don't usually get attention because they're nice and quiet in the back of the classroom. But for your kids who, are never raising their hand, or who you've never had a one-on-one conversation with, or who, try to get out of presentations, things like that, to kind of just keep your eye out for them. And, I would encourage you to maybe sort of approach them and sort of tell them that, you'd love to hear from them, and is there, can you make a deal that maybe they can, raise their hand once a week, starting with, such a low bar like that, or give them, sometimes it's helpful that maybe give them some of the questions ahead of time, so they know what you're going to ask, and maybe they can prepare an answer, that will help them feel more confident and increase the probability that they'll work up the courage to raise their hand. Things like this. So being aware of it, and sort of encouraging them to participate, sort of not letting them totally off the hook, but also being realistic and helping them, working together to see what is a appropriate expectation. So same thing we talk about with the hierarchies. What's something that they can do that's a little challenging, that's not totally overwhelming, but that's pushing them a little bit so they're not just across the board avoiding things.
Okay, and I could see these kids kind of getting lost in the shuffle for all of the reasons that you kind of described, that they're just going to be reticent about stepping up in any event. Could you talk about some strategies that the school might use when parents seem to be in denial and aren't recognizing this where the school is, and won't work with a child at home on the kinds of tools that you've outlined?
It's always tough, as a therapist, and I can imagine the same is true in a school. There's only so much you can do if parents are not on board. But one way that sometimes can sway parents, especially if you're starting to talk about like high school, is really helping them to understand how it's interfering with their grades and their performance. That they're losing points for participation, and that they're not ever able to talk in front of the class, and that it's really going to, impede their ability to, get into college and, being able to go to college and move away from home and these types of things. That usually sometimes kind of can help them open their eyes a little bit, because a lot of times with the social stuff, they'll just say, well, they're shy and they're happy with the one friend that they have, and they're not interested in sports and they don't want to do clubs. That's easy to explain away, but when you kind of bring up that it's getting in the way of their grades or their potential to be able to go to college, that sometimes can kind of kick them into gear. Okay,
the whole hold the college club over their head. Right?
That's always helpful.
I have a question about the use of puppetry as an effective way to practice social skills for a child with social anxiety. Can you comment on that at all?
I haven't come across, any programs that specifically call for that, but I could see how that could be useful.
But it's not something you're familiar with then?
No, okay. It's not something I'm familiar with.
All right. Could you talk a little bit more about the fear of being wrong and thus embarrassed, and what strategies could be used to minimize that fear?
That's a great question, because that's kind of what we think of as basically the hallmark core fear of people with social anxiety disorder, of being wrong, and kind of taking that one step further, being evaluated by others. That's sort of the core fear. So what we do is to just try to, in the same way I talked about exposures and exposure hierarchies, the way we tackle that is we try to find the most tolerable, less anxiety-provoking situation of them being wrong. So literally, sometimes we ask them to, we'll give them the assignment of raising your hand and saying the wrong answer in a class. Or, we'll make them, this is a little bit different than being wrong, but similar to being judged, we'll make them do really outrageous, silly things. Again, when they're ready for it, like, make them, walk through the library and drop their books, or, walk with, their hair all messed up. So doing things that, look silly, helping them to understand that that's not the end of the world. People do silly things sometimes, and a lot of times, we get a lot of resistance, as you can imagine, about, why would I need to do that? And the idea is, we don't want you to go on purpose doing that all the time, but these things happen to everybody, and we want you to realize that you can live through something embarrassing like that. So we really kind of take it. To the extreme. Again, working slowly up to it, but the end, goal of making them do something that's extremely embarrassing. So, which sounds harsh, but by that point they understand why they're doing it, and they're agreeing to do it, and they're in control of what they do. But that's sort of how we target that kind of thing, specifically asking them to practice being wrong and doing silly things.
Okay, good answer. This is a little lengthy, but I think it's a really good question, because it fits well with the whole anxiety thing and some OCD. And in this particular instance, there's a 12-year-old young girl with trichotillomania. And you, for the audience, you could address what that is specifically. But the question is, does social anxiety typically coexist with this disorder? And because of the disorder, the girl is just retreating from physical activities. She wears a wig, which apparently has fallen off. So how does the mom work with this child to not let the trick interfere so dramatically in creating this whole other issue? So she's got the social anxiety and some severe OCD. Okay.
So trichotillomania is compulsive hair pulling, and in terms of there were a lot of questions in there, so I'm just trying to get to them all. But in terms of are they often related, trichotillomania is a pretty low frequency thing that we see. It certainly happens, but it's not super common. So there's not a lot of data on what it's most common comorbid with. But more important to talk about sort of how to work with that. And for sure, it sounds like, and I would want to know a little bit more about the specific individual and how, much social anxiety was there before the onset of the trichotillomania, which would make a little bit of a difference about how you might approach it. But, you need to work with someone in order to really kind of decide what is the primary goal here, and what are we really going to tackle first in terms of the goal of treatment, whether you're really working a little bit more on the compulsion or on sort of the coping with the compulsion and the effects that it has. So it's kind of a hard question to answer without knowing the details.
Okay, fair enough.
But it would kind of work in the same framework as I've presented the treatment as it is. And so we might work a little bit, on, again, it depends on the child, on how willing they were to sort of talk a little bit about what is going on with them to their close friends, so that they didn't feel like it had to be a secret. Much in the same way as we work with kids with Tourette's who have very visible motor tics or very audible vocal tics, about working with them to kind of overcome the stigma of it and to be able to talk about it and educate others so that they feel like they don't have to keep this as a shameful secret. So kind of in the same way as that. No, that's okay. Just sort of within that sort of same framework, and then kind of slowly, help the child to, like I said, educate others, and or maybe find, less difficult situations to, venture out into, and kind of work from there to, more avoided or more feared situations.
Okay. Could you just talk a little bit about the role that older siblings can play in supporting an adolescent with social anxiety? I mean, what are the older kids supposed to do in managing some of this so they don't make it worse, or they don't contribute to it, I guess?
That's a really interesting question, and not one that we've done a lot of research on. One of the first reactions to that kind of question is, tell them not to give them a hard time, not to tease them or make fun of them or bully them. But actually, anecdotally, we find sometimes that those kids have a thicker skin and are actually better able to handle and put in perspective when other kids do it. So that's not necessarily the case. I think probably the best role for an older sibling is to be understanding and be able to maybe talk about with the younger sibling about some of the times when they feel anxious in social situations and how they're able to get through it, and kind of just in the same way as a parent, sort of that modeling aspect, that modeling role of how they get through some of those things.
So reinforcing that whole modeling thing.
Yeah, and being another model that maybe the kid puts a little bit more, credence in versus a parent. They may, take it to heart a little bit more if it's coming from a sibling.
All right. Let me see. I think we have time for one more question. And let me see. Would you encourage a child with social anxiety to perform in a group activity, such as singing in a chorus or band or something, to help decrease? I mean, is that something that becomes a step that you take along the way?
Sure, absolutely. Especially, I mean, you also kind of want to keep in mind, too, is that you want it to work for things that they're interested in. So if you have a kid that loves music and wants to do that and likes that, then absolutely. And then it's, that anxiety has thus far been interfering and getting in the way and stopping them from doing that. So I would say for sure, then that's something you want to work towards. But if you have a kid who has no interest in music and is not really a very good singer, then I wouldn't necessarily push that. But I would find some other performance type situation that they might be interested in. And we don't always think about it this way, but sports is for sure public performance. So if the kid is maybe a little bit more athletic, then that's a performance. If they're more artistic, showing their art is a performance. And so I definitely think it's important to tackle that performance fear, but I would say to maybe try to do it in the realm that is interesting to the kid and fits with their personality, and something that would be sort of intrinsically reinforcing once they did it. So not just the fact that they did it, but they had fun because it's something they enjoy.
And they're likely to want to continue it, too.
Exactly.
Yeah. Well, I think we've come to the end of tonight's time. I want to remind everybody to answer if you take a moment and complete the exit survey that pops up when you sign off. And I am going to say good night and thank you, Dr. Colognori. This was a great presentation.
Thank you for having me.
Thank you all for joining us on our webinar on More Than Just Shyness. What is social anxiety and how is it treated? There is an exit survey which should show on your screen after you exit. We need everyone to fill out this evaluation. The discussion board will be open tomorrow and available for the next 7 days on the NJCTS website for any additional questions that weren't covered in tonight's presentation. That website is www.njcts.org. Also, an archived recording of tonight's webinar will be posted to our website. Our next presentation, Developmentally Appropriate Anxiety, How to Help and When to Seek Help, will be presented by Jenny Ratnowski and is scheduled for July 13th, 2011. This ends tonight's webinar. Thank you, Dr. Colognori, for your presentation, and thank you, everyone, for attending. Good night. Waiting for